Welcome on behalf of the Association for Southeast Asian Studies UK. My name is Pon Souvannaseng, and I am a member of the Executive Committee of ASEAS UK and the Reviews Editor. We are an academic association of scholars, institutions, and research programs committed to research on Southeast Asia with sustainable connections and networks built within the UK and across countries. The purpose of our association is to encourage academics, students, and researchers who are interested in Southeast Asia at all levels of their career and learning. And we do that by fostering connections, professional development. We provide awards, grants to early career graduate students, and we foster linkages across institutions. So we are a member-based association. That means we're not hosted by a specific university or institution. So do consider joining, become a member. You don't have to be in the UK or affiliated with a UK institution to be a member. We have members from across 15 different countries. You have to simply be interested in research and scholarship on Southeast Asia. I want to thank our chair of the Executive Committee for ASEAS UK today, Dr. Deirdre McKay, for supporting this online series and her work to develop the association, and the fellow members of the Executive Committee. I would especially like to thank Kimberly Weir and Joe Buckley for their support in running this series. The format and ground rules for today's panel discussion will be as follows. For those of you joining us here on Zoom, you can type your questions in the public chat. But if you prefer them to be private, you can send them directly, anonymously, privately to our moderator. You can type in and look for ASEAS UK. The ASEAS UK account will field questions for anonymizing questions. For those of you watching on Facebook, you can ask questions in the comments section. And if you're on Twitter, you can live tweet hashtag ASEASUK COV19. Our Facebook page is at ASEASUK, ASEASUK, and our Twitter account is at ASEAS_UK, and our website is, of course, ASEASUK.org. Now, I am incredibly fortunate to be joined by four wonderful panelists today. First up, we have Marites Vitug, who is joining us from Manila. Marites is an accomplished author, a journalist for more than 3 decades, and editor-at-large of Rappler, a Philippine news outlet. She has written 8 books on Philippine current affairs. Her latest book, Rock Solid: How the Philippines Won Its Maritime Dispute Against the China Sea, won the Philippine National Book Award last year. We're also joined by Kirsten Han, a journalist and analyst based in Singapore who runs a very informative newsletter, very hot topic on current Singapore politics, on Singapore politics and society, called We the Citizens, which if you haven't subscribed, I highly encourage you to do so. Tricia Yeoh is joining us from Kuala Lumpur. Tricia is a PhD candidate at the University of Nottingham, Malaysia, focusing on opposition politics in the Malaysian context, and she is a fellow at the Institute for Development and Economic Affairs in Malaysia. She's also an author of States of Reform, Governing Selangor and Penang, and has directed an award-winning documentary called The Rights of the Dead. And we are lastly privileged and joined by Dr. Prapaporn Tivayanond Mongkhonvanit, Dean of the School of Global Studies at Thammasat University in Bangkok. She has been a board member of the National Council on Social Welfare of Thailand and a founding director of the Social Policy and Development Program at Thammasat. Dr. Tivayanond Mongkhonvanit has researched the financing of healthcare in Thailand. She's looked at the links between social protection, disaster risk reduction, and climate change. And she's been involved with UNICEF, the UN Research Institute for Social Development, and was awarded the Asia Society's Young Leader Award. She's trained as a public policy, economic history, and international relations specialist with a DPhil in social policy from Oxford. Why don't we start off today's discussion, starting with Tricia, and then Marites, then Prapaporn, then Kirsten. If you could maybe walk us through what the initial, well, today's topic, of course, is Southeast Asian national responses to COVID-19. So, if you could maybe fill us in on what the timeline was of the pandemic and what the initial experience was like in your respective country context. Tricia?
Hello, Pon, and thank you for having me to speak at ASEAS UK, and pleasure to be with other distinguished speakers as well. So the timeline and the background of how it all started, I think it was sort of around the time of Chinese New Year when the news broke, and then there was already some initial concern because people were traveling all outside the country. People were also taking trips abroad, and it peaked in the beginning of March. So we had a what was called a movement control order that began on the 18th of March, and it has since extended every 2 weeks, all the way till we're also considered an MCO period, but it's currently called the recovery MCO period up to at least the end of August. So that's where we're at now. One of the earliest things that happened was that what was happening was that we also had the backdrop of a political crisis taking place. And I'll talk more about this later, but it is very important to understand because while there was initial concern over this global virus, which at the time had not yet been named, the caution was completely lost once the political crisis hit. So nobody really was paying attention to the news about this pandemic any longer, or rather at the time was just an epidemic. And all attention was focused on the political crisis that unfolded. So within a 1 week period, many people were still meeting each other. And I think that also caused the public attention to not be heavily focused and not concerned about the hygiene measures at all. One of the major super spreaders, which at least in the beginning was one of the hot spots, not just in Malaysia, but in the whole of Southeast Asia, was a large Muslim gathering of about 12,500 people. It was called the Tabligh, and it's held every year, but many of the people who attended were also including foreigners, people coming from Indonesia, and also migrant workers, which is an important point that I will talk about later when we talk about the governance and the vulnerable groups. So the cluster called the Tabligh cluster, that has been the single largest cluster affecting the largest number of cases in Malaysia. And the second largest cluster actually is related to the migrant workers cluster, but I think we'll spend more time talking about that later. Some of the key highlights about the beginning of the whole MCO when the government first announced it, and also remember that it was a new government that had just come into place. So a new health minister, a new prime minister, all needing to quickly get their act together and to make decisions quickly with the civil service that had already been there. I think in the interest of time, I'll just say that there were maybe two broad themes within the first few weeks, and then in the next segment, I can unpack that a little bit more. So the big themes, number one, was that, I'm sure this happened in many countries, but in the initial days when this announcement was made that the country was going into a lockdown, there was panic buying. People were really unsure as to what was happening. And the panic buying caused also people to want to leave their homes. And this was exacerbated by this second theme, which is that there was also inconsistent messaging that was coming from the government. And I will unpack these two themes maybe later in the next segment, because I know we only want to start off with a broad approach first and then narrow down later. Thank you, Pon.
Yeah, I remember in late February, I was wearing a mask, and I was in Asia at the time. There was a surreal moment because I was in Japan on a monorail watching Mahathir's speech, while trying to social distance on a train. And I myself was having trouble focusing on COVID with all these Mahathir speeches coming out. Marites, what has been the situation like in Manila in terms of the timeline?
Yes, the Philippines holds the record of having the first COVID-19 death outside Asia. And that happened on February 1. A Chinese man from Wuhan with a female partner came to the Philippines and traveled to 3 cities. So February 1, we said, oh my God, this is it. But there seemed to be an atmosphere of denial and dismissal of the threat of the virus, because even after February 1, the president, Duterte, and his health secretary downplayed the threat. In fact, Duterte urged us to travel and, boost domestic tourism. And even the Department of Health said, okay, you can have large gatherings as long as you follow precautionary measures. And there were questions about, the Senate called a hearing and asked the health secretary, did you do contact tracing? Were you able to find the contacts of this couple from Wuhan, because they went to 2 cities, Cebu in the Visayas, which is now the epicenter, and then Dumaguete also in the Visayas, and then came to Manila where the man passed away. But unfortunately, the health department was not successful in doing contact tracing. And in a Senate hearing, the health secretary said he has incompetent subordinates. He blamed them for the unsuccessful contact tracing. And he also blamed the airlines. This is an issue of privacy, because the airlines, according to him, did not share the contact information of other passengers on the plane. So we had this problem of public good, which is contact tracing, versus privacy, which wasn't settled right away. And then, but the bigger problem was, it is a downplaying or maybe denial. And this is not just the Philippines. I think other leaders too, not in Southeast Asia, but maybe in the US or in Brazil, there was a lack of understanding, and as if there were no memory of SARS in 2003. However, the Philippines did well in 2003. We had very few SARS cases. So we had a success story then. So maybe that's why we didn't learn our lessons. So anyway, later we can talk about this. But as Tricia said, I would like to stress this denial of the leaders, denial by the leaders of the urgency and the threat, the gravity of the threat. And number 2, the battle between privacy and public and common good.
All right. I mean, what's interesting is that in the Malaysian context, you have this political shock to the system at the same time that you have a pandemic, which is also a social shock. Whereas in the Philippines, I'll definitely ask some more follow-up questions, but you have a context in which there is experience amongst politicians and technocrats of a previous outbreak. So is it that they're trying, were they trying to calm the public, or were they in denial? Definitely we'll come back to that in a second. I'm also curious to find out why Cebu was the epicenter, or has become the epicenter. Dr. Tivayanond Mongkhonvanit, what's going on in my hometown of Bangkok?
Yes, thank you very much. So in Thailand, the first coronavirus infection was detected basically around January 13th. And the gravity of the whole situation wasn't really felt initially by the government as yet. But then there was a turn of event which happened around March. And there was a vicious spread of the COVID-19 amongst a crowd of people who attended the Lumpini boxing match. There, 100 people were tested. Half of them, about 50 people, were infected. And so that really brought the attention to the government. At that time, I think there were several government sectors, working in the area, basically the Ministry of Public Health. But eventually, there was a Center for COVID-19 Situation Administration, which was set up around March 25th. And that really actually substantiated the effort of the government to seriously look at the situation and to deal with the situation. And from that center, we had technocrats, bureaucrats, public health officials from the Ministry of Public Health, communicating with the public, fostering analysis and teamworks with other ministries. And so with that center, the general public has had very basic and foundational understanding of the COVID situation. And it's been a very fact-based communication between the technocrats and the public health officials to the public. And they've been able to garner, I would say, some level of trust among the general public about what is going on, and also the preventative measures in the situation.
I think that's an interesting contrast because, you know, we hear from Marites that the initial response, at least in March in Manila, was, as she described, one of maybe denial or slow-footedness. And you seem to be describing in the Thai case, would I be right in saying that they tried to get ahead in terms of public communication and you know, maybe that there was more room for health officials and technocrats to sort of step into that space in terms of sharing
Yes.
power?
Indeed, I think they felt that the communication, you know, basic communication that allows people to understand what is going on is very key and critical as to how the general public was going to react. But I think this is also compounded with the local structure as well. You know, the Center for COVID Situation Administration, they were working very closely with the local administration, basically provincial and also district public hospitals. And we had a very strong, solid health security system that's been in place for about 40 years, dealing with not just, you know, the current COVID or SARS, but going back into the 1970s, working in like topical diseases and things like that. So the correlation, the work that is happening between the administration with the local entity, with the local authorities is a very powerful one. And I think this has been a turning point for Thailand as well, that we see clearly that we've been able to detain the situation quite well.
Well, this is not Thailand's first time around the block. I mean, there's definitely an AIDS crisis. Kirsten, I'm gonna unmute you. And, you know, if you could walk us through the timeline in Singapore when it first hit in Singapore. I remember seeing the news headlines about Singapore fairly early on, but then it seemed, you know, that things got under control. So let's hear from you.
Yeah, so the first case was reported in Singapore on the 23rd of January, and the government response was really quite fast. Actually, a day before that first case was reported, they already announced that they had a multi-ministry task force that was going to look into COVID. Well, at the time we didn't know it was called COVID, but that they were going to look into the coronavirus. And it was, you know, building on processes and structures and protocols that had been brought in after SARS. So, you know, we had learned from that previous coronavirus. And so the reaction was really fast. They were really, you know, on the ball with testing and tracing. So very aggressive contact tracing. You know, if you tested positive, you would have to talk to a contact tracer and provide them with a list of places you've been and people you've been in close contact with over the past 2 weeks. And then they would start phoning up everybody. So at one point we had such kind of aggressive contact tracing that a high number of the COVID cases that were being reported were actually cases that were found because people were being called up by the authorities and saying you've got to come in for testing and you've got to be quarantined or you have to stay at home. And so that was going really well, and we were able to keep the numbers fairly stable, which got Singapore a lot of praise internationally for having managed it so well. You know, we were kind of described as having a gold standard in test and trace and everything. And so it was all looking pretty good for us up until the end of March, when it was discovered that COVID had broken out within the migrant worker dormitories. And so Singapore has a large population of migrant workers. almost 1 million work permit holders. That's about almost a fifth of the entire population of Singapore. And so of these workers, about over 300,000 of them are male migrant workers working in industries like construction and shipyard and manufacturing, who live in these dormitories. And in these dormitories have been known for a long time to be quite cramped and crowded. So, you know, an average of 12 to 20 men in a room, they sleep in bunk beds, and, you know, many men sharing toilets and showers. And so when I was talking to these workers, they were saying for a long time that, you know, since January, the government has talked a lot about how we must do, you know, we must practice hygiene, and if we can do safe distancing, and the workers were just saying it's just not possible to do safe distancing in their dormitories. One worker was telling me how there's not even 1 meter of space between his bed and the next guy's bed. So saying that we should do 1 meter safe distancing was plausible for most Singaporeans, but not possible for migrant workers. And so Singapore's COVID problem is very much spreading through the dormitory. So as of yesterday, we have a total of 44,122 COVID cases reported, and about 94% of them are the migrant workers in these dormitories. So they, you know, the prevalence of COVID among their population is extremely high compared to everyone else. So the prevalence rate among the migrant workers in dormitories is almost 13%. So 13% of all of them have reported positive for COVID. And it's probably going to be more because we still have, you know, the numbers are still over 100 every day when they come in. So that's really sparked off a lot of discussion about Singapore's treatment of migrant workers, which we can talk a bit more later. But we had a circuit breaker. So it was a lockdown, but the government didn't want to call it a lockdown. They called it a circuit breaker from April 7th until the 1st of June. And now we're in phase 2 of emerging from the circuit breaker. So phase 2 now means that restaurants can do dine-in service again. So you can have social gatherings of up to 5 people. And so it's slowly going back to normal daily routines. But in the middle of this as well, the ruling party has called an election. So we're currently in the middle of a 9-day campaigning sprint to polling day, which is on the 10th of July.
I want to get back to you about this question. I mean, so there's a lot to unpack here, but I definitely want to circle back about whether, so in the Singapore case, we have an earlier outbreak than anywhere else. You know, there's public trust, there's an expedient bureaucracy that jumps into action in January versus, you know, Marites was saying that even in late March, some authorities in the Philippines were in denial. But it seems from your characterization, Kirsten, that there's the social protection, you know, schemes had limits when it came to migrant workers, and that seemed to be the Achilles heel. And then, you know, what's interesting to me, and at least hopefully we'll come back to this in a second, is that Tricia was pointing out this very early onset double crisis of both a political shock event and a biological shock event. And in Singapore, I don't know if you would describe this recent election, recent call for a new election to be a political shock event. But there is, you know, we have an early sort of new political rearrangement in Malaysia, and it eventually arrives in Singapore, but in you know, 3 or 4 months later. So definitely, I'd like to kind of ask both of you in terms of these different political realignments and whether they, you know, COVID is an exacerbator of existing cleavages, or whether it's actually a breaking or turning point. You know, things that came out of COVID have caused these political realignments, and of course, we haven't seen these political realignments in Thailand or the Philippines. We haven't seen, you know, new calls for elections. I could be wrong, so I'll why don't we start with, I'll go back to Tricia and then go back down to Marites.
Okay. All right. Yeah, I think that it's a pretty nice segue into the next topic on government. So as I was saying, we were hit by this twin shocks of political and pandemic crisis. And one of the things, of course, was that the new government called the Perikatan Nasional was unprepared to be a government because it was sort of cobbled together in a very haphazard manner. And to give you an idea of what the new government consisted of, it consisted of one party of the recently collapsed government, Bersatu, or Mahathir Mohamed's party, for those who are familiar with Malaysian politics. But it did not include Mahathir Mohamed. So there were various factions that were also contesting the position of prime ministership. And more importantly, the new government coalition consisted of UMNO, which was the dominant party that had ruled Malaysia and that had lost in 2018, as well as a long-time opposition Islamic party called PAS. So these three parties came together to form the new government. Why that is important is for several reasons. Number one, UMNO had been known to behave in a dominant authoritarian manner while it was in power. So Malaysia has been described as an electoral authoritarian regime. And so one of the things that immediately came about was that the new government decided that the Ministry of Health, while being important in terms of being a communications point, they also formed a national security, they used the National Security Council to make decisions with regards to COVID-19. So there was immediately some concern amongst human rights activists and civil society because once you hear the word National Security Council, there were concerns that the new government would be using this as a guise to impose even further restrictions that went much further beyond what was required for managing the COVID-19. I suppose the insecurities and the anxieties that were being felt on the ground were just accumulating because of these uncertainties and uncertainties on both levels. So one of the surveys which I looked at showed that 66% of people experience anxiety during this period, and that was coupled by, of course, other economic shocks that we can talk about later. But the second thing and why it was important about the unpreparedness and unreadiness to step into the position of power was that some of these ministers, some of them had experience before, but many didn't. And so there were many different missteps that took place along the way. The health minister, for instance, he actually said publicly on air that you could drink warm water and this could solve the virus. This could cure the virus. And another minister, the minister of, the Ministry of Women and Family Development, they put a series of Instagram and Facebook posts encouraging wives who were stuck at home with their husbands and possibly resulting in tensions and fighting to behave in a very ladylike manner, and they were asked to speak in a gentle voice, and they even cited this Japanese character Doraemon to speak in a gentle Doraemon-like voice to their husbands. So I mean, I'm just citing two examples, but they were very quickly ridiculed by the public, and also it did not send a good message that there was public confidence with regards to the ministers. And of course, that I would distinguish that from the civil service, which I think we'll talk about later in terms of the abilities of the technocratic level of civil service to rise to the occasion during a time where the political crisis was at such a height. But having said that though, I will say that the communication strategy of government was done excellently. So they set up like Telegram, what's it called, accounts or like a Telegram room, a Telegram channel. So there were two different channels. One was from the Ministry of Health and another one was from the National Security Council that I mentioned earlier. And these two channels, they would flood the channels with a lot of messages. So one of the surveys also showed that Malaysians were actually very happy with the government having kept the public well informed with accurate information about the virus. So 95% of Malaysians said that they were happy about that.
Would it be fair to then characterize the Malaysian context in those early days as in the midst of this political chaos and sort of changeover, that it was that, you know, you're saying that there's public confidence and the bureaucracy was able to step in, at least reassure and actually set and implement a national health response. I don't know whether, you know, maybe not, and we're going to hear from Marites in just a second, but was it draconian, or, you know, was there contact tracing, or what did they roll out? Or did they actually, you know, was it slowed down or sort of, you know, caught up in the political turmoil?
The contact tracing in Malaysia was nowhere as sophisticated or efficient as Singapore. So it was a lot of voluntary, you know, if you were in contact, so they put out SOPs, like if you were in contact with someone who was infected, then these are the things that you need to do. So it was not so much top down as it was like community, you know, upwards sort of voluntary. But I will also say that well, two things. One is that this crisis has actually shown that Malaysian public health system has the capacity to be able to cope with something like that. So quite quickly as well, a lot of the, not just the hospitals, but public facilities, they were gazetted as potential places that patients would need to be put into. And I don't think, you know, many of these places were even used to any sort of capacity at all, which means that there was still room for emergency cases. And number two, precisely as you said, the Director General of our Ministry of Health has come out of this completely like the hero. Before this, nobody knew his name. Nobody even, I think, really cared about the civil service, and a lot of criticism actually was leveled on the civil service for being lazy and unproductive. But that's another topic altogether. But I'm just saying that this has provided an opportunity for the civil service to rise to the occasion and show off its colors.
I think a good bureaucracy is like a good car. You know, it's discreet and silent, and you know, you don't hear all the problems. Usually, so technocrats are usually these quiet, discreet, efficient people. Marites, you know, what was going on in terms of the Philippines, in terms of the political context? I know that, I'll say his name, I guess, Duterte, you know, is a fairly strong-handed leader. I wonder, you know, and you've mentioned the role of his appointees, but you know, how was the governing space there in terms of in the Thai case, we were, you know, there was discussion that public health officials could get a handle on this by sort of stepping into that space and moving forward quite early. And you know, what was happening in the Philippines?
Yes, you know, actually now, if we look at the performance of Southeast Asian countries, Philippines and Indonesia are lagging behind our neighbors in terms of containing the virus. Indonesia now has the highest number of cases, and I think, if I'm not mistaken, it's Singapore and then Philippines. But in terms of recovery rate, the Philippines is the lowest, and we also have the highest death rate per 100,000 population. So this is the effect of the denial, dismissal, the delayed. You know, I think two things. It's really early action and decisive action, and it's really testing and tracing. Anyway, so in March 6 was when we got the jitters, because that was the first local transmission already in the Philippines. So we were thinking, oh my God, so this is it. Yet 3 days later, President Duterte addressed like 1,000 mayors in a packed hall in a hotel. And again, you know, still in denial, saying, no matter if I shake your hands of 5 million people, it's not my time, I won't get the virus. So that was already 3 days after the first community transmission. And after that event, some mayors reported positive for COVID-19. So it's not there has been no detailed contact tracing, so we cannot establish really how many. But on top of this, there is an interagency task force for policy making, which is headed by the health secretary. Unfortunately, our health secretary is really not, it was complacent. In fact, in late February, he told the world in a press conference, the Philippines is a model in handling the virus. Late February, because we had no local transmission yet at the time. So you were talking about, like in Thailand and in Malaysia, they had efficient bureaucrats, technocrats. In the Philippines, there is no epidemiologist in the in the policy-making body who is a decision maker. The epidemiologist is a consultant to the health secretary. So we don't know what is the influence of this epidemiologist in terms of pushing the health secretary to implement certain measures. So that's why, so the president had this policy-making task force, and he formed a national task force to implement, which is headed all headed by retired generals. Because Duterte has said, I like working with generals, with the military, because they simply follow orders. They don't argue with me.
Well, on that note, if I could ask then, Tricia made the comment that in Malaysia, what she had noticed was that there is a robust, there's an architecture there to fall back on. And I wonder if in your assessment, is there a public health system and a public health administration that has the capacity to do so, but perhaps for political reasons are either afraid or constrained or excluded from doing so, but by those who are in the decision-making realm.
Yes, compared to Thailand and Malaysia and Singapore, I think we have a very weak public health system. But in 2003, the Philippines was able to contain SARS. There was already a setup of contact tracing. So it also depends on the leadership. We had a very good health secretary. Then he was a public health expert. So we could see the difference between 2003 and 2020 in terms of leadership. So for example, yes, we have an unprepared public health system. We only had one testing laboratory during the outbreak. So it was an uphill climb to reach 66 now, compared again to Thailand's over 100 test centers, and even Vietnam's over 100 test centers.
Right. Okay. Well, I think these shock events, they shake the foundations of whatever systems are already in place. But then if you have constrained resources, good management is even more important. This is such a fascinating discussion. We are getting close to time. We've got another 6 or 7 minutes to go until Q&A. So I will continue on with our two further speakers, and then we'll go to our last theme. I just want to remind viewers out there on Facebook and in Zoom, you can feel free to, if questions are coming up for you along the way as we are discussing this, you can send questions into the public chat or to our moderator, who will be keeping track of all these questions and then sending them forward. So feel free to ask your questions and pose them to the moderators. Dr. Tivayanond Mongkhonvanit. You have to unmute yourself. Sorry.
Right, Pon. Okay, I was just saying that in terms of Thailand, the government officials have given credit to the government of Prime Minister Prayut Chan-o-cha for his overall decisiveness. Others have entertained different views, and obviously there's factions in every country, but the decisiveness did make a difference. and like I said earlier, provincial and local authorities have also displayed their unique capacities to manage the pandemic in their localities and communities. And in terms of that decisiveness coming from the government, you know, he could have opted for a different route if he had wanted to. And indeed, I think local and even foreign medias have been quite reluctant to give the government credit because of the authoritarian legacy. So it is fair to say that, you know, this is something that, you know, people, the general public are still, you know, they still have this sense that we're not too sure what's happening. But so far, the span of the pandemic has shown that the Center for COVID-19 Situation Administration has provided a very strong leadership in directing the fight against the virus. And each agency before this was doing their own thing without coordination. So the CCSA, the COVID Situation Administration, has really centralized the entire antivirus campaign to fight the virus. And I would have to say that, you know, when the government declared the emergency on March 24th, it was, you know, the general public was still very careful at large. There was still suspicion on its real intention. And they feared that the government could actually abuse its power during the emergency, but that has not happened. So the 4-phase easing scheme has worked well, you know, for the period that it has. And so we do see actual collaboration, and we do see, you know, on point with this situation.
Well, a part of that is the military, as you said earlier, that the military government is also willing to take the advice of scientific and health experts, right? So Marites was saying that when Duterte formed this executive decision-making council, it's mostly army generals, and there was an exclusion of epidemiologists and other health experts into that circle. Are you aware of whether or not the ruling party and, you know, other, you know, generals, presumably they were taking advice from technocrats, and they were in the room, presumably.
Yes, so they have been taking full advice from the technocrats, and I think it's because, like I said earlier, it was getting out of hand for the first 8 weeks. You know, the Minister of Public Health was trying to impose certain measures, but I think there wasn't that leadership and that ability to coordinate the whole country in terms of the ministry. So when the technocrats were pulled together and, you know, sound advice from the medical profession, I think that really you know, changed the course of how the situation was dealt with. Obviously, I'm saying this with in mind that there are those who feel that, you know, there were several severe repercussions as well. You know, the schools being closed and the repercussions of that with the children and things like that. But I would say, in terms of containing the contagion, they needed that effort, and I think the government. It was because it was not only just the medical profession within the ministry, but because there was a network already in place at the local level. You know, the village volunteers, you know, they were the ones who were very critical in containing. There were about 1 million village volunteers who went around working, each person working with 10 to 15 families, trying to mitigate the situation by providing health literacy, trying to observe the situation within that locality so that there's nobody infected coming into the community. And so they needed that network, Pon.
Yeah.
So, yeah.
And I think, I mean, as you said, Thailand is on in terms of phase reopening, but I guess the picture from the Philippines seemed that it was, I heard that it was, you know, one of the more draconian lockdown measures, you know, that they were slow to get going, and then when they did, they really, you know, went full force. So it's, you know, I don't think Manila is reopening yet, right? Marites?
Not yet. We're still in some form of quarantine until the end of July. We had one of the longest and strictest lockdowns in the world. At least 2 people were killed. 2 quarantine violators were shot dead. There was, ordinary citizens who were posting on Facebook, were arrested if they were critical of government. So I think it was a lopsided, there was very strong control, but very weak on public health. So that's the overall picture under Duterte. So it's really unfortunate that we still are, are lagging behind, and we won't be able to be part of your travel bubble in Thailand.
I'm going to move on to Kirsten in a second. I am conscious that we are getting short on time, so I'm going to move on to Kirsten, and then I'm going to ask each of you for your, sort of final minute remarks on, sort of societal implications and impacts on this, and then we'll move to Q&A. Kirsten? Oh,
so in terms of, for Singapore, there has been some speculation that perhaps, firstly, migrant workers' rights groups say that, that there was just neglect of the migrant worker community in general, which led to this massive blind spot of not seeing it, because anybody who knew the conditions in the dormitories would be able to say that this is really a very vulnerable population. And it's not the first time there's disease outbreak. There's been dengue and chicken pox and stuff, and measles that have broken out within dormitories. So rights groups have been saying, that COVID is going to be dangerous for the community, and then they were not really kind of listened to. And then it broke out, and there was just some speculation that perhaps in late February, March, when Singapore looked like it was doing really well and was getting a lot of praise internationally, getting a lot of headlines about how like we were the best in the world at dealing with this, it seemed like there was some moves to perhaps call the election then. And maybe the ruling party thought they could ride off the wave of all the international praise of how well they've been doing. And then the migrant worker thing broke out. So there was obviously no elections then. We went into lockdown instead. And so now we're having the elections. But I think...
Does that play into this current abrupt, I would characterize it as just an outside observer, this abrupt election that has been called? I mean, I think there's less than about a week of campaigning, right?
Yes. So
it's a very short time frame, and is that linked to the migrant worker issue, or is that a sort of a separate dynamic?
No. So Singapore has always, for most of our history, gone with the legal minimum for campaigning. So our elections have always been this short. Between 1959 and now, there were only 2 times in our history where the election period went longer than 20 days. So this year it's 17 days, which everyone is so tired. But yeah, I think there was a lot of criticism about having an election in the middle of a pandemic and what kind of public health risks would be involved.
And do you think the COVID impacts and the COVID, both economic and social, are key platform issues going into this election?
Yeah, so Singapore, because of COVID and everything happening around the world, is going into one of the worst, if not the worst, recession that we've seen in our independent history. So it's predicted that the economy could shrink up to 7% and up to 200,000 jobs could be lost. So there's a lot of anxiety, definitely, about jobs and, kind of job security, cost of living, economy. So that's something that, a lot of our parties are definitely talking about now. And also the ruling party is portraying itself as being, the kind of guiding light out of this crisis. So they're saying throughout this election, give us a very strong mandate, because only with a strong mandate can we, with confidence lead Singapore out of this crisis. And trying to play on this, trying to make the voters more risk averse. And so there's been discussion about how likely would it be that there's this flight to safety mentality going on during this election, because it's such emergency and extraordinary times that people might not want to do anything risky. They might just prefer to vote for what they know. And so with Singapore elections, it's never a discussion of what the result will be, right? Everyone knows what the result will be, that the PAP will win. It's unthinkable that they won't. So the discussion is always what is the margin of this result. And so this time, the opposition parties are saying, there could be a complete opposition wipeout, and the PAP could just basically have 100% control of the parliament if people got really worried and decided to vote with what they know. And so that's kind of the narrative that's being pushed either way now.
I just want to check in with each of our panelists. We're in our final 10 minutes and we do have a lot of questions. Are all of you okay with maybe going 5 or 10 minutes over? Is there anybody who absolutely needs to leave? Okay, great. So we'll run a little bit over. I want to give everybody, a last 1.5 minutes in terms of, issues in terms of social implications and final remarks you want to. Well, not totally. I'll give you guys time at the end for final remarks. But before we head into Q&A, going back to Tricia, Kirsten has been talking a lot about the migrant worker situation in Singapore, and I think Tricia, you wanted to sort of highlight various aspects in Malaysia. I'm going to have to unmute you and.
Okay, thank you. So in my final 1 minute, I just wanted to say 3 things. One was that I think that there are some similar themes across the region. Marites was talking about draconian measures in the Philippines. Malaysia doesn't compare quite to that extent, but we did have, 26,000, almost 26,400 people arrested in violation of what we call the MCO, and 10,875 compounds. And sometimes, the application of these draconian measures was also quite unequal. So you had some kids who are just, jogging or playing sepak takraw, which is a traditional football game. They would be in prison for weeks, whereas there was the daughter of an UMNO president who was fined just a minuscule amount for doing things that were worse in that kind of relative scale. So the lockdown measures were definitely quite, I think, harsh, commensurate with the kind of public health measures taken. Not commensurate, I mean. And another example of that kind of draconian measures, so this zeroes in on the migrant workers. So yes, I did want to emphasize that amongst the more vulnerable groups in Malaysia, of course it includes low income families, contract workers, short-term contract workers, but I feel like the most vulnerable group that has been impacted the worst within Malaysia has been migrant workers. So again, the number of undocumented as well as documented workers can go up to about 4 million people in Malaysia. And on top of that, we've got about 180,000 refugees. And throughout the month of May, there were more than 2,000 such migrants / refugees / undocumented people arrested across Malaysia, mainly Kuala Lumpur. And those who were detained included children, pregnant women as well. And this really raised the question of infection spread amongst those who were detained. And sure enough, by the end of June and early July, from amongst those who were detained, there were 775 positive cases. So, like I said at the very beginning of the talk, the detention of migrant workers accounted for the second largest cluster in Malaysia, the first being the tabligh gathering, as I mentioned. And this has really caused, I think it will continue to cause effects across the economy. Just like Singapore, our economy depends on migrant workers for a whole range of, construction, F&B, and many of these have already been threatened by the government to say that they should not hire foreign workers because of this fear of the COVID spread. And this was inconsistent with the assurances that government had actually made at the very beginning when they called people to come forward to get tested. They assured them that no arrest would be made. So that's the unfortunate outcome of what's happened from amongst the migrant workers. On top of that, I think there's been a lot of xenophobia within Malaysia and hate speech. So this really doesn't help them because it pushes them to go further into hiding. So with that backdrop, the third thing I wanted to say to end this is that just like Singapore, well, not like Singapore, there has been speculation about the possibility of a general election by the end of this year. It's still unclear as to whether that's going to happen or not, but the political crisis that began in February has not ended, and we are already in July. So I'll just summarize the crisis, which is that the current government has a very razor-thin majority of 1 seat in parliament. So we have 222 seats, and he has a majority of 112. He has 112, so a majority of 1. Coupled with that, there's a leadership tussle within the opposition, and the situation is very fluid. And because of the negotiations that have not resolved themselves, some parties are calling for a general election to take place, which would be very interesting. And of course, we don't want to speculate about the outcomes, but those are the things that I wanted to say before we end.
Oh, we're not ending. We're going to go into Q&A. But it is, you know, it's, I'm sitting here in the UK, and, you know, there's the outbreaks are also, a number of them are in meatpacking plants with migrant workers. I think, you know, this rise in xenophobia, the scapegoating and stigmatizing of, you know, refugees, migrant workers, immigrants, and, you know, how that plays into politically calculated electoral politics, as, you know, this stuff is hopefully going to launch a ton of COVID dissertations. So Marites, I'm unmuting you. Make sure you're unmuted. All right.
Actually, as I was listening to Tricia and to Kirsten talk about the migrant workers, the Philippines is one of the countries that supplies your migrant workers. And that's a very big worry now in the Philippines. About 300,000 are coming home, mainly from the Middle East because they've lost their jobs. But already we have more than 50,000 who arrived, and a number of them are seafarers. Again, just to remind, the Philippines is one of the top 5 supply countries of seafarers. So with the cruise ships gone, you know, it's such heartbreaking. It's very heartbreaking to see all these seafarers coming home, and, you know, for how many months, maybe how long they will be without jobs. And apart from the returning overseas Filipino workers, in the month of April, we lost, the Department of Labor said that 5 to 10 million people lost their jobs. And we had the highest unemployment rate so far at 17.7%. And that's not even covering the fishermen, the farmers who were unable to sell their produce. So in the second part is the decline in remittances. Remittances shore up the Philippine economy. They're equivalent to 9% of our GDP. So you can imagine the economic downturn. Well, of course, all of us will be in this experience economic downturn. The Philippines will be, I think, one of the most wounded or inflicted by this pandemic. Reduced remittances, returning overseas workers. And also, just one last point, there was a survey done in May, and it's a very credible survey, and hunger rate exploded because of the lockdown. There was no public transport, you know, it was very difficult to sell your produce. So anyway, it's so bleak. I'm sorry. Anyway, we have other questions maybe coming up.
We have tough times, but, you know, we're here, and we're hopefully going to talk through this together, at least for today. Prapaporn, I'm going to unmute you. Make sure you're unmuted on your side.
So in terms of the migrant issues in the country, obviously we share borders with Myanmar, Laos, Republic, and also Cambodia. And so we see many of the migrant workers from these countries, if they have, you know, some of them have actually realized that they tried to move back actually before there were repercussions about the COVID situation, because they understood that there was going to be no jobs, no income, and no access to healthcare. In terms of statistics, there's about 2.8 registered migrants in the country, but obviously there are, you know, high number of 2 up to 3 millions of unregistered, undocumented migrant workers. So these people really, you know, they don't have access to healthcare. Even the registered ones, they you know, they have entitlements to health insurance. I mean, they have to pay health insurance basically, but when it comes to actual entitlements, they are pretty much excluded because of crude exploitation, or even just because they don't know where or how to access the medical help. But I would want to kind of extend the conversation over, especially in Thailand, because the part of the population that was very much hit by this whole situation was the informal sector, and there was actually a relief payment generated to the informal sector, about 5,000 baht, or about $175. Many people apply for it, but there was still backlash because they did not have access to the internet, or because of their family registration. Some of them, for example, were driving taxis in Bangkok, but their family registration was as farmers, you know, and back in their own suburbs or in their own province. So they didn't have that chance to get the relief payment. So informal sector is very critical in Thailand, because, you know, we're ranked 7th among the countries with the highest ratio of national revenue coming from informal sector, 57% of GDP, and the workforce, the informal workforce constitute about 24 million people. About 62% of the employment rate is informal. So that's why we really feel that this is going to be rather dire, you know, in the near future. Also, I think my last remark that I want to leave is that in understanding this whole situation, I think it points out that, you know, we shouldn't be just thinking about those without the money who's trapped in poverty, but really thinking about the vulnerability of people, you know, and it's circumstantial. They might not be vulnerable today, but in the future they are. And this relates to the whole social safety measures of the country, the whole social safety system. And in Thailand, per se, the narratives of social safety net has always been about economic conjecture and arguments, about human resource development, about productivity. So given how this is going to rear out, there could be a real chance to expand the social safety net for the people. There's also possibility to integrate whatever platform we have at the moment. I give you the example of the child support grant that we have. You know, many people who were hard hit by COVID and who eventually did not have money to feed their children, did not have access to it. So things like this kind of platform can be integrated and adapted so that we could have a more generous sort of platform and kind of push the social safety net in a proactive way, and it's not just reactive measures that we're doing for by the country.
That's great. I'm going to double back to you in just a second, because that is one of the questions that we had in, you know, thinking about Thailand, but, you know, the whole region in terms of reliance on tourism and the dependence on the migrant labor population, as you said, in Thailand, both people who work in the informal aspects of the tourism sector and other migrant laborers are excluded from, cash transfers or, you know, any kind of stabilizer policies. So the question, you know, there is, if there is a second wave, you know, is that kind of, as somebody who works in social policy, is that then when, you know, we might see some more formal expansion of these programs, or, you know, what Tricia was describing, are we going to see more people being kicked out of the system and, you know, detained or abused? Kirsten, I'm going to shift to you for the last minute. We have a lot of questions coming in, but one of the questions I thought might be related to some of the issues you raised about migrant workers. And, you know, one of the people have asked, whether you think, at least in Singapore, the pandemic has strengthened arguments for NGOs who are working for and on behalf of migrant workers and refugee rights, or, you know, is this actually a time in which makes that harder for those kinds of organizations? I didn't want to hijack your time, but if that, you know, as you've been discussing migrant issues, I thought that question might be pertinent.
Yeah, so there's been kind of good news and bad news. I guess the one silver lining that, you know, people would rather have done without if it could have meant more safety for migrant workers is that it did give more momentum to migrants' rights NGOs than ever. It brought it really very much to public attention. And, you know, migrant rights groups say they've seen a flood of donations and volunteering and people who want to reach out and help migrant workers. So that's been good. But they're also not very optimistic that things will change fundamentally for the better, because what rights groups have said is that there's a lot of attention on the dormitories now, because you know, people talk about how, oh, it's the dormitories that allow COVID to spread, and the rights groups are saying no, it's exploitation, really, that it's about vulnerability, not just about the dorms, because basically the government has agreed that, oh, the design of the dorms need to change, but the problem is far bigger than how you design the dormitory. So, you know, there's the fact that they're paid so little, that they have no job security, they're not allowed to unionize, they're afraid of making their bosses angry because they're afraid of repatriation, because they can get their work permits cancelled anytime. So they don't, you know, they don't dare to ask for sick leave, they don't dare to ask for time off work and things like that. And in the lockdown period, migrant workers have had a much stricter and more draconian lockdown than the rest of Singapore. So they locked down the dormitories, which meant over 300,000 men were essentially confined not just to the dormitory compounds, but to their rooms. And so even during meal times, they can only send one representative downstairs to get food, and then they eat in their rooms.
Yeah,
and
there's
so it's, yeah.
I mean, that relates to a question that's come in about regarding risk to workers, you know, what labor and union organizing has happened, right? And I wonder, you know, if these stronger draconian measures which are being implemented in Singapore towards migrant workers, even if, you know, does that exacerbate, I imagine that exacerbates simmering tensions, or does it make a more compliant workforce that is, you know, even more suppressed or unable to organize?
Yeah. So they're not allowed to organize. They are not allowed to be in unions. So these workers don't have the right to do that. It's increased, I think, the surveillance and the draconian. So one more recent change is that the Employment of Foreign Manpower Act was amended recently, and rights groups have been raising the alarm about this, but not getting anywhere because it's election season and no one's thinking about migrant workers that much anymore. But the law was changed to now say that migrant workers need consent to leave their dormitories. And this law is not in the COVID temporary measures law, it's in the Employment of Foreign Manpower Act. And so the rights groups are asking, does this mean that this law will remain even post-COVID? You know, essentially, are we saying that migrant workers will now be essentially imprisoned in their dormitories unless they have specific permission to leave? And, you know, that just actually, you know, even if you improve the design of the dormitories inside, that does not improve their condition, because, you know, it's not good enough if the prison is a bit nicer, but you're still in prison. And also during this whole kind of outbreak, the rhetoric used was quite othering. So for example, from the very beginning, when the outbreak was detected in the dorms, the government said to Singaporeans, these are two separate infections. So there's COVID in what they call the community, and then there's COVID in the dormitories, and they referred to this as two separate infections. They've been reporting the numbers as dormitory cases and community cases. obviously then the connotation is that migrant workers are not part of the community. And as long as it happens in the dormitories, which are ring-fenced away from the rest of the community, it's not a bigger concern to Singaporeans. And it's kind of been treated that way, like, oh, you know, these are just in the dormitories, they're kind of ring-fenced in there, they can't come out anyway, so it's not of concern to us. You can kind of see from a sort of logistical point of view why they would do that, because the conditions that migrant workers live in are very different from the conditions of other people who don't live in dormitories quite like that. And so I can totally understand that you would want a specific tailored response to an outbreak within an environment like that. But the messaging that's sent when you consistently say there are all these cases, but they're not in the community, just further kind of creates this sort of rift between the population and migrant workers.
Thank you. We're running over time, but this has been a riveting discussion. We have some key questions that have come in. You guys are allowed to, answer any aspect of any of these questions. I'm going to name the three main questions that have come in, so take them as you will. The first question was the one that I posed earlier. For any of you in thinking about your country context, what are the prospects for coping with the second wave, especially given regional reliance on tourism and dependence on migrant labor. Continue on with the labor question. Kirsten's been talking about how migrant laborers are more detained, under more surveillance than other workers. And so the question is, regarding risk to workers, what labor and union organizing kind of labor politics might we be seeing in other country contexts? The potential for uprising and backlash. And do you see there being much cooperation or discussion? There's always the ASEAN way, right? Where leaders will, of course, do what ASEAN leaders do, but how likely does anybody see that the prospect of a travel corridor being created within ASEAN? So sorry, those are the three questions. Second wave and the impact on how will you deal with lack of tourism, labor politics, travel corridors, and if anybody wants to take the last question, is if in your country context, how are religious gatherings being managed? Large religious gatherings. So religious gatherings, travel corridors, labor politics, and second wave tourism impact. Why don't we start with Marites? You can, any of the four questions you want to take, please be brief.
Yes, actually, I mentioned earlier that we're feeling left out of all the travel bubbles being planned by Vietnam, by Thailand. So, and we're not even we're just in the first wave. It's a long first wave. So tourism is still out of the question. I think eventually the Philippines will do domestic tourism, but not at this point. But I just wanted to highlight the ASEAN question. I wanted to answer partly the ASEAN question because this was raised in another webinar. Can the ASEAN countries get together and arrange and have an agreement for treatment and vaccine? Because Europe has already arrived at an agreement with Big Pharma, but we're happy to read that Thailand is already on the human trial of the vaccine. So maybe ASEAN, even with its slow ASEAN way, can get together and arrive at an agreement to already engage different companies so that when the vaccine and the treatments are available, then we will have access to it. So maybe that's just one point I'd like to highlight.
It's a great point. I mean, you were cynical about these dire times at first, but that seems like a fairly optimistic, it might happen. We might be able to collectively work towards vaccination. Tricia, what's your take on any of those four? Oh, unmute. Sorry.
Yeah, I find this ASEAN and whole regional thing very interesting. And I just wanted to touch on one aspect which we haven't really talked about, which is the supply chain. So one of the big things that came out from the whole COVID and MCO in Malaysia was that the supply chains were under strain for many reasons, right? Because the factories that were producing the certain parts that were required for essential industries to operate. So essential industries like food were allowed to operate, but the others that are supplying the things for the industries to operate were not available. And I think if you kind of expand that whole supply chain question up to regional level, I mean, I wonder whether at the regional level, ASEAN could actually cooperate to reopen some of the supply chain chinks that have resulted in shortages of, well, food primarily, but for other things as well. And I mean, food, of course, like I think Vietnam had a restriction on trade early on. I'm not sure what the situation is now, but I would really feel that cooperation is quite imperative with regards to getting the supply chain going, because our countries are all dependent on trade, and as a bloc, we would be able to negotiate much more strongly together, and also then as a bloc negotiate with other countries like China and so on. So that's on the ASEAN point. Coping with the second wave, well, this will be really hard. I think all our countries will face like even more severe recessions. Already we're in recession. I mean, Malaysia's unemployment is the highest in 30 years. And there will be severe like fiscal pressures as well. So Malaysia is quite highly dependent on oil, and about 19% of our budget comes from Petronas, our oil and gas revenues. And so Petronas is under pressure. And this all happened at a time when already the Malaysian economy was not doing well, and we've been stuck in this middle income trap for such a long time. Our talent pool doesn't rise because there's lots of migration taking place outside of Malaysia, many of whom actually go down south to Singapore. So I think coping with the second wave, health-wise, I think we already know what to do in terms of the SOPs, but the economy will probably suffer a much greater shock if the government decides to maintain as severe and strict measures as it did during the first wave. Yeah.
Prapaporn?
Yes, so the country is being very cautious about the travelers coming in. The CSA currently has announced that they've allowed business people with actual business in Thailand to travel in and out, as obviously with the quarantine. But Thailand is proposing a travel bubble pilot scheme, which is bound to be featured around August, and this is just to test the areas, the 5 different places in the country, including Chiang Mai, Koh Samui, Krabi, Phuket, and Pattaya, right? And the move is reportedly, it's meant to be experimental, just to see if there's going to be further contagion, and they would allow for tourists to enter a maximum of 1,000 people per day without having to go through the quarantine. So the travel pact or the travel bubble is set to go through 3 stages, initially in August, and then just to see how many contagion transpires, and then they have a second and a third phase going through forward. So that is in terms of the tourist aspect. In terms of how we're going to deal with the second wave, I think the CCSA is still going to be in control of the whole situation. They have kind of tread a very strategic path. Even in terms of testing, you see that Thailand comparatively is not doing or conducting as many tests as other countries, but they're doing things that are very strategic in the sense that they're focusing on high-risk groups, they're focusing on points of entries. So these are the sort of things which are, also in the decision of technocrats and medical professions. So we still have a long way to go, and I think it's in my understanding because we have international organizations abound in Bangkok as well, and they are being very cautionary. They're seeing this as transpiring over until 2022 21, right? So yeah, we still have a lot to witness.
Interesting about the travel bubble, whether, you know, the ASEAN way is about cooperation, but sometimes it's also about comparative advantages. So, you know, I wonder if, you know, if certain countries are able to enact or act early on re-implementing tourism. Kirsten, we've got to, just to remind you, you know, how are countries facing management of religious holidays or other large festivals, labor rights, travel corridors, and second wave?
Okay, so our large houses of worship are still closed, and they won't be opening until later, I think. We don't have any indication of when this phase 2 exit from the circuit breaker will end and go into phase 3, which is, I think, complete reopening. Well, the communication that was very good at the beginning has kind of become a bit more confusing as things have gone on. So right now, everyone knows that we're in phase 2, but no one knows when phase 2 ends, and no one knows what phase 3 exactly looks like. We definitely are starting to talk about opening up a little bit again. So we've opened a green lane for business and official travel with 6 provinces in China. And I think we've been also talking to Australia and New Zealand about that and looking into what other countries can be included on the list based on how well they've responded to COVID. There is a green lane with Malaysia now as well, I think, going between Singapore and KL, and definitely going between Singapore and Johor, which is just across that causeway. There's definitely been more talk about easing travel, because one thing that happened when Malaysia brought in its movement control order was that they shut the borders, and there was not quite enough advance notice to the thousands and thousands of Malaysians who cross the causeway to work in Singapore every day. And so there was a huge rush to figure out what to do, basically. So I know in Singapore there were volunteer groups that were literally like trying to crowdsource housing. You know, can we find hotels? Can we find hostels? Does anyone have a spare room? Because all the Malaysians who decided that the best thing to do was to just literally move to Singapore during the movement control order period, because they would never be able to go back and forth like they would usually do. And then there were businesses who were really struggling because suddenly their manpower, like I went to a restaurant and the manager was like really apologetic because he said manpower has half because half his Malaysian staff couldn't cross the border to come to work, and they were essentially just stuck. And so that sort of thing is easing up a little bit now. But I think it'll be some time before travel really kind of becomes a big thing again. The government's actually closed an entire terminal of our airport for the next 18 or so months because they said travel's not starting up again. Let's just use this time to renovate the terminal, which we've been wanting to do because, you know, they're not going to be using it. So yeah, there's that. I think for a while we're going to be set to see that for a little while. The other thing that I didn't bring up earlier was just COVID and surveillance as well, because Singapore's been very much pushing that tech angle as a very technocratic government who wants to be a smart nation. You know, this idea of technology has been a big thing. So they've been pushing this app called Trace Together, which is supposed to be helping with contact tracing. Unfortunately, they needed 2/3 to 3/4 of the population to download it for it to work, but only 1/3 of the population did. So it didn't really work, but how it applies to labor is that Trace Together is voluntary for everybody unless you are a migrant worker, especially a migrant worker in a dormitory, and then it becomes compulsory. So they have to download this contact tracing app on their phones. What I've been hearing recently is that it doesn't work once it gets on their phones, but you know, they have to download it on their phones. So I think that's another example of how, in terms of, you know, the low-wage workers, they are exposed to a lot more surveillance than the rest of the population as well.
Well, I'm gonna thank you very much. This has been such a stimulating conversation. I'm gonna quickly summarize, I think, some of the key highlights from today's discussion and then allow everybody to sort of say their last words. I think, you know, a lot of what came up today is about how these very difficult times have allowed for the further marginalization of already marginalized groups. So if you are able to act on existing powers of the state, those are now being, you know, weaponized or utilized to clamp down or use the powers of surveillance or actually detain or confine the public as a whole, but certain groups much more than others. In terms of timing and efficiency of responses to COVID, you know, and these various kinds of shocks, the way that the timeline unfolded in these different countries, some regimes have broken, as we've seen. Some regimes have been reconstituted, but it seems that one of the main aspects has been whether in response times like this, bureaucracies and public health systems and, you know, specialists are able to share governing spaces with decision makers to be able to influence and shape policy in terms of disaster responses or emergency responses. And then I suppose the last point I've always wanted to I've always kind of thought about as a Southeast Asian person residing in, you know, Western Europe, that the winds, you know, blow from east to west, that what we see in terms of casual labor, you know, urbanized housing and things in Southeast Asia, they take a decade or so, but they eventually blow west. We see that with, you know, informal taxi cabs in Bangkok are now ununionized Uber drivers in the US and the UK. And so I wonder, on that note, thinking about, you know, winds blowing from east to west, what any of, you know, our panelists might have for our broader viewers out there in terms of, you know, any Southeast Asian messages for other countries that are going through same but different issues. I want to thank everybody today, both our viewers who have tuned in way over time, but definitely our panelists, all of our panelists, for such a rich and insightful discussion and bringing, you know, your expertise and views to this table. Thank you. So Tricia?
Yeah, I'll just close by saying that I think in Malaysia, we've seen the COVID-19 as accelerator of some things, and it was also an opportunity to highlight some things. So first, in terms of how the COVID-19 was accelerator, I feel like it accelerated the political situation that was already tense and fracturing, and it made the political factions worsen. Because, you know, the parties weren't able to meet, and the uncertainties just exacerbated political tension further. I think it's also accelerated the way that government and society have reacted against groups like the migrant workers. It accelerated the already pre-existing, you know, ethnic, xenophobic, ethnocentric sentiments. And I suppose it's also, as a second theme, it's highlighted existing tensions. So one of the areas that I work in is in federalism. So it's highlighted the tensions between the federal government and the state government. So Malaysia is a highly centralized country. And one of the things I didn't mention earlier was that while the states were involved to some extent in the cooperation to manage COVID-19, the federal government eventually made a lot of decisions in a top-down way, and the states, some felt, were excluded in some of the major decisions, especially in the reopening of the economy. So 9 states actually initially defied the order and didn't want to do that because they felt they weren't reasonably consulted enough. It's also highlighted the importance of 2 very important groups in maintaining social order. One is the civil service, which I think I talked a lot about already. And it's also highlighted the importance of NGOs and communities. So in the same way that NGOs rose up to the occasion in Singapore, the same happened in Malaysia, where a lot of NGOs came in to help the refugees and migrant communities that were completely excluded from any sort of social security aid that the government provided to the citizens. And the NGOs have played an incredible role in working together, not just together amongst themselves, but also in collaborating with or trying to, at least in some occasions it was difficult to do that, with the social welfare department. And yeah, I guess I'll just stop there. But just to say that I'm not sure whether this is the same experience in other countries. I'd really love to hear from the rest, actually, maybe not just now, but later, whether there was an inconsistent application of regulations, because I'm not sure whether it was a factor of a new government, but there were many times that they had to change their positions, and that caused tremendous confusion amongst people, especially from amongst the business communities. So I hope that won't happen if we were to have to face a second wave. Hopefully the government would have learned from its missteps. Thank you.
We are in a time of uncertainty, so I think everything's kind of being, discovered on the fly, but as we go. Marites?
Yes, actually, for us here in the Philippines, our elections for president will be 2 years from now. So this for us is a big lesson already on leadership, on being a leader in times of crisis.
Do you think there's going to be a civil society? I mean, if it's 2 years away, where does that leave civil society?
Well, civil society has been active during the pandemic. I guess I forgot to mention the role of the vice president. Here in the Philippines, the vice president is just a spare tire, and she happens to be a woman, and she happens to be the leader of the opposition. So she wasn't given any role in policy making, in implementation, but on her own. Her office is the smallest budget in the Philippine government, yet she was able to respond in various ways to the needs. So that is another kind of leadership. But I mean, a lot of people, I think our Filipinos are thinking now about 2022. It's still 2 years away, but I think we learned that we should value leadership and whom we vote into power in 2022. And as Tricia said about tension between local and national, we've also seen that here. And we have the silver lining is we've seen good local officials, good mayors. They have stepped up and they have contained the virus in their towns and cities. So that is really heartwarming for us here. But on the national level, it's not that good news. So anyway, it's really also to give credit to the private sector. Big business was wonderful in a way. Sometimes I'm very skeptical of big business, but they delivered, and they were able to help, even provide testing centers and quarantine centers to really speed up the response. So thank you, Pon, for organizing this, and thank you to my co-panelists.
Thank you. Prapaporn?
Yes, well, I think in Thailand's case, you obviously see that the whole situation has highlighted the strong technocrat and bureaucracy role. But amidst all that, it's important to just see this in the general context that who the government listens to really begs further question about how they're going to deal, for example, with economic stagnation and things like that, because stringent measures were taken under the medical health profession's advice. So we still have to witness what's going to happen in terms of trying to pull the economy back and forward. But I think in terms of the overall experience, I think I want to leave with this message, and that is, I hope that the COVID-19 will build on the lessons that we should learn from past efforts. And I think as a person working in social policy, we need to promote social protection in times of crisis. The lesson we learn here is that there's a real need for institutionalized social protection before a crisis, rather than scrambling around to put something in place after the crisis. And I think I want to leave with that message. Thank you.
Thank you. Kirsten?
Yeah, I think, it's been really quite inspiring to see the amount of civil society activity and just informal groups springing up during this period, particularly in a lockdown, right? So people who can't even leave their homes trying to organize. And particularly to see it from young Singaporeans who are often very much stereotyped and dismissed as apathetic, apolitical, selfish, millennial strawberry snowflakes. It's been really very inspiring to see them organized. Within days of going into lockdown, there were they use all the skills that they have. There were infographics and educational kind of resources. They were linking mutual aid schemes and coordinating and compiling resources that people could look at. There were spreadsheets that were about mutual aid so that people, low-income families with need to like cover rent could put in their needs in a spreadsheet, and then people would send them money or, communicate and liaise with them about what they needed. In the middle of the lockdown, we started doing young people on Instagram, started to do things like virtual book sales, so that you would like sell books that you have at home so that you can raise money to transfer to families that needed it. And so it's really encouraging. I hope that these things will continue to build and gather momentum in Singapore, because it's about strengthening a civil society that in Singapore for the past few decades has been very much oppressed and immature and not allowed to mature. So it's been good to see that, and some of that sort of skill and organizing and compiling resources with technology is translating into the elections now. There are more, in this election, there are more political education resources being compiled and produced and shared on social media than I've seen in the past 2 elections. So there's definitely a lot more sort of education and communication in this way happening, and I hope that we will continue to carry that through. I think what we've learned as well is that, Singapore doesn't have the same problem that Malaysia and the Philippines does, right? We don't have a local federal problem because we're such a small country, everything is local. But I think what I hope people will learn is that, with COVID, as we've seen, kind of nobody is safe until everybody is safe. Like the reason Singapore went into lockdown wasn't just because we had a lot of local transmission cases, but it was also because the numbers were spiking so much across the country. And the government was really struggling to deal with the dormitories that they just went everybody locked down. So, we do kind of have an impact on each other's lives. And I hope that there will be more kind of discussion of this. It's kind of got a little bit buried now because everyone is so preoccupied with the elections. But I think we might come back to some of these discussions. And young activists are definitely pushing the angle of COVID and inequality and climate crisis. And I think they'll continue to be pushing that beyond the elections and beyond the pandemic as well.
Well, thank you to all the panelists today. Thank you for all of you who tuned in. We went way over time, but if you enjoyed this session, I hope that it's the first of other online events that we'll be hosting at ASEAS UK. So do consider becoming a member. At the very least, please follow us on Facebook, ASEAS UK as a group and a page, and visit our website. And to all of my panelists, I hope to see you again soon. So thank you very much. Take care, everybody.